Atrial fibrillation is a condition where the top two chambers of the heart are no longer contracting. Now, normally you have the top two chambers, they contract first, and then the signal goes down to the bottom two chambers, and then they contract. In atrial fibrillation, they don't contract, they just quiver. We call that quivering fibrillation. So that's where the word atrial fibrillation comes from. That fibrillation is a quivering. Now, atrial fibrillation is not dangerous. It's not going to kill you. It doesn't shorten your life. It doesn't cause mortality to go up or anything like that, but it can give you a stroke. When the top two chambers are no longer contracting and they just kind of quiver, that the blood can pool in all those little crevices and cracks in your atria and your two top chambers, and it can cause clots. When blood's not moving and when it coagulates and causes little clots, and then parts of those clots can break off and go to your brain or your kidneys or other parts of your body. So the most important thing is to be on a blood thinner when that happens. Now, there's two ways to treat atrial fibrillation. One is a rhythm control strategy where we try to put you back in rhythm. And one is a rate control strategy where we try to put you into just a good rate. You stay in AFib, but we get your heart rate better controlled. Both options work. In the last 20 years or so, we found that controlling someone's rate is equivalent in terms of stroke to getting them back in rhythm. But a lot of times people just feel better in rhythm. So we try to do that first and try to keep people in rhythm. And that's about it. So talk to your cardiologist or your electrophysiologist about atrial fibrillation and your options. Definitely make sure you're on a blood thinner if you can be. And then definitely see if you want to do the rhythm control method or the rate control method. And you got to talk to your cardiologist about this, and I'm sure they'll pick a good option for you.